Let's talk large lesions. Okay, so large lesions, all of these are going to have one thing in common. They're all going to be greater than a centimeter. So that means that they are going to be larger than just the eraser head. And that could be anything larger than a centimeter. Okay. So the first one is a pretty common one if you've ever had an insect bite or a mosquito bite or spider bite or bee sting or something like that. It's called a wheal. So wheals are basically typical of allergic reactions. So it might be to something that you ate. It might also be something that you contacted. But a lot of times it's due to some sort of an insect bite or sting. And sometimes it's due to some sort of an injection. So a vaccine reaction might also fall into this category. But the typical thing is that it's going to be greater than a centimeter in size. It's going to be raised. But if you look at the surface of it, it really has like a raised area and then a flat top, and then and it comes back down. So it plateaus. So you can see that here, that it goes up and then it flattens across and then comes back down. There's also a typical color to the border. So if you go to the margin, it's really, really red. And then if you go to the flat top, it has a lighter center or a lighter ring. And that's typical of these sorts of swellings. They are not filled with anything, so they have zero filling. It's all tissue inflammation. And so it's all dermal reaction. These round lumps, keep in mind, can fuse together. And so we can see patches that occur that are not discrete wheals, but you can still see that red margin. So you shouldn't be able to be fooled by that. That's still going to be red, raised, itchy with a lighter internal flattened border and no sign of fluid, whether it's clear or pussy, right? Just tissue inflammation. The next raised lump that you need to know is the abscess. And the abscess is a collection or a pocket of infection that has been walled off inside the body. So how abscesses occur are typically from either an infection that started deep in a body cavity that got walled off, or from an injury, a superficial injury like a puncture wound that got walled off. Okay, so let's use the example of the internal infection. Like this gentleman here likely has this abscess as a result of a tooth infection. So if that tooth infection made its way into the soft tissue of the gums, then it could create a tiny pocket that starts to fill up with pus. And as it expands and expands and expands, it creates more and more pressure, creates a soft lump, and then eventually most abscesses will at some point rupture and open. A lot of times they open to the surface, which is preferable. Sometimes, if they're in the wrong location, they'll actually rupture internally, which can cause internal infection and sepsis, right? So if you had an abscess that was forming somewhere in your gut, rupturing to the interior would be, a deadly situation, right? Because you'd be releasing infectious agents and pus into the body cavity, and that would infect everything. The most commonly seen abscesses happen with cats, because cats have claws that have a lot of bacteria on them, and they essentially puncture each other with their claws. And those puncture wounds heal over at the surface really quickly, but they don't often get cleaned out, and they don't often have a chance to granulate in and grow in from the bottom to the top. So if you cap and crust over a puncture wound, then you're not allowing it to be adequately cleaned, and you're also not allowing that bottom tissue to grow to the top first. You're just creating a pocket, and that pocket is where infection will brew, right? And so then you end up with things like this that have to be lanced. We use a crosscut again so that wound stays open this time and allows all of that pus to drain out, flush it out, and usually treat with companion antibiotics as well. So that's an abscess. They can be really large or they can be relatively small, but they're never going to be smaller than a centimeter and still be called an abscess. And then finally, just FYI, if you want to be able to describe a lump that is rounded, larger than a centimeter, and doesn't seem to be containing any kind of pest or infectious agent, but it's just like this random bump, we call that a nodule. So there's usually no redness associated with it. There's no infection associated with it. It's just a bump, and they can occur anywhere in the body. So if you see a lump that's larger than a centimeter, there's no redness occurring, the general term would be a nodule. Once we examine it, we might find that it's a cyst or a boil. We might find that it's something like, like a fatty lipoma. But before we know that and do any diagnostics, any kind of non-red large bump is called a nodule. And those are your large lesions.